learning lab on qualitative data collection and analysis in the context of using the UNHCR WFP Joint Analytical Framework, or JAF. So this is the fourth in a series of 6 webinars that we've been organising on the JAF. And today's Learning Lab is very much complementary to the last Learning Lab that we had a couple of weeks ago, which focused on quantitative data collection and analysis. So if you missed that one, I'll put the link in the chat. You can watch the recording. And as part of today's webinar, we will be looking at how quantitative and qualitative data are complementary and how they can be combined in the JAF analysis. So as we know, the JAF is a set of tools which help us to better understand the ability of refugees and other forcibly displaced people to meet their basic needs, be those food needs or non-food needs. So this concerns both UNHCR and WFP, and we have colleagues from both agencies here today, so welcome everybody. To get us started, I have a first poll to understand your familiarity with the topic today. Let me launch the poll. Apologies, I'm just getting used to the new version of Teams. Here we go. So I hope everyone can see that. If you can't see the poll, go into the chat. You should be able to find it there. How familiar are you with qualitative data collection and analysis on a scale of 1 to 5, 5 being a real expert and 1 being not at all familiar? So just how would you rate your familiarity? Please fill it in. Okay, and I see the results coming in. Okay. I'm going to have to do some maths. Just thinking about the way these results are presented. So I'm seeing most people are, the majority of people are up to level 3, level 4. So in fact, 95% of people, well, no, 5% of people feel that they're real experts, and 95% are between kind of level 1 and level 4. So yeah, quite a mixed group. That's great. I think whatever your level of familiarity with the subject, we hope that it's going to be a really useful webinar today and will inspire you and provide practical guidance on how you can use these tools in the analysis that you'll be doing. So we have a great group of qualitative data enthusiasts and experts with us today. We have Federica from WFP, who's Assessment and Analysis Officer. We have Ricardo from UNHCR, who's Protection Officer. Michelle from the Joint Hub, also Protection and AAP Officer, and Felicia from the Joint Hub too, who's a Joint Data Analyst. And myself, Olivia, I work with the Joint Hub and I'm Monitoring and Learning Officer, and I'll be facilitating today's session. So if we look at the content and learning objectives for the session, it should last about 45 minutes, including 10 minutes for questions. By the end of this learning lab, we hope that you will be able to describe the importance and purpose of qualitative data when using the JAF. You'll be able to use the JAF qualitative questionnaire, which we'll be sharing with you. That you'll be able to outline the process for setting up focus group discussions and key informant interviews, and that you will be able to also conduct qualitative data analysis and understand how it feeds into the overall JAF analysis. So we will have time for questions. If you have questions, pop them in the chat. We'll answer them at the end after the presentation. This slide provides an overview of the JAF process. On the left, we have a diagram of the JAF that shows all the different topics that are covered from national to community to household level. We've seen this slide in previous webinars because it gives us an overview of the whole process. On the right, when UNHCR and WFP are working together, the first step is to agree on the joint objectives for the analysis, agree on the scope, then to conduct a desk review, a review of secondary data. We covered this in one of the previous webinars. You can watch the recording if you weren't there. The desk review helps to identify what data we already have and what data needs to be collected. So then to identify the scope of data collection, both qualitative and quantitative, to collect the data, to analyze it and use the data to inform and modify your programming. Okay, so now we're going to talk about the importance of qualitative data, and I will hand over to Ricardo for this section. Ricardo.
Thank you, Olivia, and hi, everyone. So understanding first why it's important and what is qualitative data. If you remember the slide that we've seen before, I mean, the poll, we had like a 3.1 level of familiarity, 93% more or less in level 4. That is all quantitative data, right? We have numerical information about the level of familiarity. However, if we wanted to understand further what are your experiences, how you have been facing challenges, or what are the good practices you have, we should go into other type of data collection or data methods. So qualitative data is this type of methods, right? So it provides non-numerical information that is descriptive, and it explores more nuances of human experiences and behaviors. It can complement quantitative data gathered through surveys at the individual or household level, and as well other qualitative data that has been gathered, for example, through a desk review. If we go, for example, for previous webinars, what was explored in previous webinars, we could understand that, for example, through a desk review, gathering qualitative data, we will have an understanding of the policies landscape. So how refugees are being at the policy level considered or being able to meet or to access livelihoods and to meet needs, basic needs through income generating activities. But as well, we will need qualitative or quantitative data on the level of income, the food consumption score at the household level. But all that will need to be complemented with qualitative data. And for example, to understand what is preventing households to access those basic needs. And information gathered can give us, for example, information on discrimination happening at the community or within the household power dynamics. So how do we gather this? Well, usually it's collected through consulting key stakeholders, including, of course, forcibly displaced people, but as well host communities, local authorities, and expert staff. If we go to the next slide, we see that this one. We will see that the particular added value is that it offers a fundamental step in engaging communities. We are giving forcibly displaced people and other stakeholders an opportunity to share their views more directly, including suggestions and concerns. And that is why it was integrated in the joint analytical framework. If we go to the next slide, we saw in previous webinars, and as Olivia was mentioning, you can access those in the chat, the recordings. We saw that we collected in the upper level, that national level information through a desk review in webinar 2. And then in webinar 3, we saw more quantitative methods used at household level at the core of the framework. What we will discuss today is how do we engage community through qualitative methods. And with this, I pass the floor to you again, Olivia. Over.
Thank you. Sorry, I'm muted. Thank you, Ricardo. I'm going to hand over now to Federica for this next section to talk about the tools that we have, the analysis plan and the questionnaire specifically. Over to you, Federica.
Thanks, Olivia. So I just want to start from the same graph that Ricardo presented. So Ricardo emphasized that the qualitative data collection is done at the community level. So as you can see from the graph, there are different factors that we have identified at the community level, and these factors are critical to be able to understand the household's ability to meet basic needs. So in the focus group discussion tool that you can find as part of the JAF package, there is a questionnaire that is structured around these 7 factors, which are the understanding of who are the most vulnerable household, safety and security, economic opportunities, availability of services, availability of information and feedback mechanisms, social cohesion, and social and gender norms. So each of these factors in the focus group discussion template is accompanied by some questions that will help you to structure the discussion with the community. Can we move to the next slide, Olivia? So in the focus group discussion tool, you will find that some of these factors that we call modules have been identified as essential, while some others are optional. So the essential ones are the core topic and question that are considered fundamental as part of the JAF objectives. So we carefully choose this module to be able to complement the quantitative data collection and the secondary data review. You will also see in the template that there are some optional modules. So the questions that are included under the optional modules are of course relevant, but you can choose whether to include them or not, depending on the information gaps that you have identified during the secondary data review, and also depending on the specific context where you're doing your assessment. And it's important to highlight that these are guiding questions, so it's really very much up to you to take the question, review the question, and adapt them based on the context. And you can choose how to rephrase the language to make sure that the language is accessible and understandable by the data collectors. Next slide. I just want to point out your attention on how the template for the focus group discussion has been created, and in particular on the introduction of the template, which we think it's quite important that all facilitators, note takers, and colleagues that are going to train facilitator and note taker familiarize with. In particular, in this part, it's an introduction that help you guide the discussion, and in particular it focuses on ethical conduct and informed consent, that it's essential to get started with the focus group discussion. So going through the introduction, participants get fully informed about the purpose and process of the discussion, including any potential limitation or risk. We want to make sure that they understand their rights as participants and that they are reassured about the confidentiality throughout. So as you will see in the template, we have designed the question to avoid addressing any sensitive topic or individual protection incident. However, in this introduction in the template, we do explain that if any sensitive topics do come up, both facilitator and note takers and participants are reminded to handle this situation with care, ensuring confidentiality. So we strongly encourage that before starting the focus group discussion, the facilitator and the note taker get familiar with the introduction, and they also practice how to explain this introduction as part of the focus group discussion. And also in the training that you're going to do to the data collectors before the focus group discussion, it's important that you focus on this aspect. Next slide. So finally, and unfortunately, we don't have time to go through the details as part of this webinar, but I just only wanted to point out that as part of the JAF toolkit, you will find a qualitative data analysis plan. Last time in the previous webinar, my colleagues presented the quantitative analysis plan. As part of the same worksheet, you will find a tab in the Excel file which focuses on the analysis plan for the qualitative data collection and analysis. The plan is basically a framework that helps you identifying how for each of the indicators that are part of the data collection, how you're going to analyze them. And it also helps you to organize the analysis part, understanding who is going to be responsible for analyzing each indicator, what methodology you're going to use, and what's the timeline. And in the last slide, but it will be mentioned at the end as well, on the JAF website, you can find the template for the questionnaire and also the analysis plan. So you can download them and familiarize yourself with both of them. I'm gonna stop here and I'm gonna hand it over back to Olivia. Thank you.
Thank you, Federica. I put the link in the chat to the JAF toolkit. We have a website where you can access these tools. So yeah, the link is there for you. Okay, now we come on to the next section of today's webinar on setting up focus group discussions and key informant interviews. And I have a question for you about what should we bear in mind when organising a qualitative data collection exercise. Federica's already mentioned some of the things that we can bear in mind, but what in your experience should we bear in mind? I'm launching the poll now, so you can write in 2, 3, 4 words, even 1 word here. This is actually an example of qualitative data collection because it's an open question and then the data will be organised and presented. So please write in your responses here. What should we bear in mind when organising a qualitative data collection exercise? I'm seeing some answers coming in already. Okay. This is being analysed in a word cloud, seeing gender, sensitivity, clear format, diverse participants, bearing in mind the analysis, AGD groups, age, gender and diversity groups, taking into account different identities, how they're represented. Right. Great, concise questions. Okay, lots of interesting answers. Thank you. I'm going to hand over now to Michelle to talk more about what we need to take into account when organising qualitative data collection.
Sure,
Michelle.
Thank you, Olivia. So yeah, many great points mentioned by colleagues, AGD, sampling, who should be the participants. So I think we'll pick up on many of these things on the next few slides, not everything, we also have limited time. But yes, so let's go to the first slide. All right, so first of all, I want to point out that the JAF documentation actually focuses mainly on FGDs, but also want to bring up KAIs here as an option because they can be useful in certain contexts. And to make sure that we're on the same page in terms of the differences between the two, let's look at a few points. So FGDs are group discussions, right? And usually good practice is to have between 8 and 12 participants. In FGDs, we have a great opportunity to better understand community perceptions, opinions, suggestions, and current concerns that people have. Also, we can observe group dynamics, which is a big advantage of FGD. So we can see where are there common views among community members and where are there disagreements on certain key topics. Key informed interviews, KIs, are done usually with just one person. Those are individuals who have in-depth knowledge about the community. So we're talking potentially community leaders, local authorities, or expert staff among us. KIs are also helpful in managing power dynamics. So, for example, community leaders can be quite dominant. So including them in group discussions can result in them dominating those discussions. So it's good to include them rather in key informed interviews. Lastly, we can bring up certain sensitive topics in group discussions depending on the context, but that will be mainly at a very global level. So if you want to dig deeper on certain issues, for example, GBV, it's usually better to do that with certain key informants. Next slide, please. Okay, so inclusiveness and AGD came up. So this is what we have here. I think everyone is familiar with the age, gender, and diversity approach. So we want to make sure that we include different types of participants, people of different ages, different genders, that we consider other diversity factors. So we include, for example, persons with specific needs and people of different nationalities, especially where we have refugees from different countries of origin. There may be IDPs in certain contexts or host communities that live in proximity that we also want to include. Then as the next point, it's recommended to do separate group discussions with women and men. In some contexts, this is necessary due to cultural reasons, but even where this is not needed due to cultural reasons, it's good to do because that way we can collect gender disaggregated data, which will help us better understand the findings. Language, of course, is very important. So we want to make sure we hold the consultations in the languages that the participants understand and speak. And when needed, we can work with interpreters, of course. Visual materials is also an option when doing group discussions, for example, to make it clearer when talking about the most vulnerable types of households, for example. Visual materials could be helpful, or if we're in a context where there's a settlement or a camp, we can use community mapping to figure out where there might be safety and security concerns in the community. So a few ideas. Timing is also important. Usually we plan the consultations or the data collection exercise when it's convenient for us, but we should also make sure that we consider people's livelihoods and household responsibilities and plan around that as much as possible. Access to the consultation locations is really important as well, especially so for persons with a disability. So we want to avoid doing the consultations or the data collection in locations where people, for example, have to walk stairs. Next slide, please. Then in terms of sampling, so this qualitative data serves to complement the household survey data that we already have, right? Which was collected among a representative sample. So usually there's no need for a representative sample for the qualitative data, right? For the FGDs and the KIs. But there are different non-probability sampling strategies out there. Some of them are, for example, convenience sampling or snowball sampling, but the most common one is purposive, or sometimes called purposeful sampling, where we select the participants based on their relevance to the issues that we are collecting data on, right? So we want to make sure we have participants who have relevant insights to share. There is actually a really good WFP guidance document on sampling for qualitative data collection exercises that we can share with you, maybe in the chat. So that will help you figure out or learn more about different sampling strategies. Now, what does this mean for us for these types of exercises? How do we get to the number of FGDs and KIs where relevant? We want to follow the AGD approach, as mentioned just before. Also want to make sure that we consider different geographical contexts. So forcibly displaced people, for example, might be residing in camps or among host communities and host villages or in urban areas. So we want to make sure that we get insights from the different contexts, because vulnerability levels can be different, or access to livelihoods opportunities can differ between contexts. Then there's the issue of security, which can also limit access to community members in certain contexts. So that needs to be kept in mind. And some of the consultation sessions, especially the KAIs, could also be done potentially online, for example. Lastly, the principle of data saturation. What that means is we reach data saturation when we have explored the different topics to well enough extent, let's say. So we have received a comprehensive range of responses from participants, and no new views are being shared by the participants. So it's a bit tricky to know beforehand when you do the planning when you'll reach data saturation. You can sit together and try to figure out and have your best guess together. And also during the data collection, of course, you can take data saturation as a point where you conclude the data collection exercise, maybe even early if you feel like you don't have to do all the sessions because you're reaching data saturation. Next slide, please. Then there's, of course, it's very important to train the consultation teams, so the facilitators, the interpreters, where those are relevant, and the note takers. So I want to make sure that everyone is on the same page in terms of the objective of the data collection. Here I want to mention that it's really important to be careful when selecting interpreters, because you want to make sure that they're neutral and impartial in relation to both the discussion topics and the participants, right? Then there's ethics that should be covered in the training. Federica has spoken to that already. So we're talking informed consent, that participation is voluntary, confidentiality, but also that consultation team members know how to receive feedback and complaints, including sensitive complaints, and how to refer those, right, appropriately. Then the questionnaires should be reviewed as part of the training, of course. What we want to highlight here is the importance of terminology. So we want to make sure that the facilitators and interpreters and the note takers are on the same page when it comes to understanding the different key terms, so that also the interpreters know how to interpret those terms, and that the responses received, so the questions are asked in the right way, and also the responses are understood and recorded properly. Lastly, it's good to do a field testing with the consultation teams, or do a role play between the training participants, which helps people, the consultation teams, to become more used to the questionnaires, and helps to increase the quality of the data that is collected in the end. So I think that's all. So back to you, Olivia.
Thank you, Michelle. So we have talked about planning the data collection. We've talked about refining the tools and actually collecting the data. And now we come on to the analysis. We've got all the data. How do we analyze it? And I've got another poll for you. It's an open question. I want to collect some qualitative data on this. Let me just find the poll. Okay, so the question for you is, what challenges might you face when analysing qualitative data? You've collected all this data. What challenges might you face when analysing qualitative data? And again, as with the last poll, this is going to be a word cloud, so you can write 1, 2, 3 words in there. Bias. Okay, I'm seeing some answers coming in. Coding. Wrong answers. I'll give everyone some time to think about the challenges that you might face when analysing qualitative data. Maybe challenges you faced in your experience, or challenges you imagine you might face. Okay, great, lots of answers. Felicia, can you see the answers as well? Can everyone see them? I'm seeing bias, data visualization, understanding, translation, grouping, the quality of the answers, accuracy, tons of data. Yeah, tons of data. How do you make sense of it all? Okay, interesting. Right. Felicia, I'm going to hand over to you now to tell us more about data analysis. Over.
Thanks a lot, Olivia. It's very unfortunate we cannot do an analysis of the data that we just received before this presentation, but I'm going to walk us through qualitative analysis. So qualitative data analysis involves interpreting meanings, reasonings, concept, and experience related to our research subjects. It's important to note that this process is highly subjective, as we can see from some of the answers that were given, and can be influenced by researchers' perspective or theoretical stance. We use a variety of methods such as thematic analysis, discourse analysis, or grounded theory to make sense of our qualitative data. For example, in thematic analysis, we identify recurring patterns or themes in the data, whereas in discourse analysis, we focus more on analyzing the language and communication within particular contexts. These methods help us to identify patterns, themes, and underlying structures within the data. Additionally, we can utilize qualitative data analysis software such as NVivo, Atlas, TI, and MaxQDA to facilitate the analysis process and manage large data sets efficiently. As also from the survey, we saw that tons of data was a problem. But when you have small data sets, usually you can analyze these manually. Qualitative data analysis provides contextual, subjective insights that are rich in detail, but may not be generalizable. It is important, however, to emphasize that qualitative data importantly complements quantitative research approaches. While quantitative research focuses on numeric data and generalizability, qualitative research offers in-depth insights and understanding of complex phenomena. This will try to show in our ongoing work in the Zimbabwe JAM 2023. Next slide, please. The Zimbabwe JAM 2023 covers refugees and asylum seekers in the Tongogara refugee settlement. This is a settlement situated in the eastern rural areas of Zimbabwe and has a population of 16,182, which is roughly around 5,200 households. About 3/4 of these population is from DRC, 11% from Mozambique, 5% from Burundi, and 4% from Rwanda. Quantitative data was collected through a household survey, which was done at the end of November using a representative sample. The objectives of the qualitative data were formed from the results coming from the quantitative analysis as well as the literature review. The qualitative study aimed to collect data to 1, fill the existing data gaps, 2, to enhance the understanding of meanings, reasonings, concepts, experiences, and complexity of issues from the TRS. It also aimed to validate quantitative results, specifically the profiles of vulnerable households that were coming from our household survey analysis. Both country offices, including the RBs, were involved in the design of the tools. This helped in coming up with contextually relevant guides. Sampling of participants was done by the field staff, and a data collection app was jointly developed in Moda and tested. In total, 13 FGDs and 5 KIIs were carried out. Data was collected first week of February. Next slide, please. So the use of the just highlighted JAF qualitative analysis plan, which Federica talked about, has been critical in organizing and preparing for analysis, as the indicators and guidelines are very clear and easy to follow. The analysis is using the qualitative data analysis highlighted on the right. These steps can be done iteratively to make sure all relevant results are explored. Both context and thematic analysis were identified as most appropriate methods to meet the qualitative survey objectives and also relevant to the data that we had collected. In order to address researcher bias during analysis stage, we have several team members involved in the analysis, as well as an independent researcher carrying out parallel analysis of sample data. Validation of results will be done with the country office as well as the RB, and if possible, with the TRS residents. Next slide, please, Olivia. So on reflection of the quantitative and qualitative data, there are indeed differences in the objectives, the type of data collected, sampling strategies, questionnaire or guide design, including how data is collected. For quantitative, we usually use interviewer-administered methods, whilst for qualitative, this is facilitator-led. Next slide. The difference also exists in the kind of analysis that can be carried out, the software that can be used, and even presentation of results. Next slide. Thank you, Olivia. While there may be differences in qualitative and quantitative data, they are both useful in giving a complete picture of the situation under review. The example here shows findings from both qualitative and quantitative data. You will find that both data sets did agree and showed us that households that received vocational training and or were involved in income generating activities were more likely to be less vulnerable. However, quantitative data showed us that only 12.9% of the household had access to livelihood support activities, and technical discussions with the livelihood experts in the camp helped us to understand the livelihood support activities within the settlement, while the FGDs with the community helped us understand what were their preferred livelihood support needs, which would help our livelihood colleagues, especially when they program around livelihood support. So as mentioned before by all my colleagues, qualitative data enriches the data beyond just counts and numbers that are provided in the quantitative. And on this note, I thank you and hand over to Olivia.
Thank you so much, Felicia. Thank you for the example from Zimbabwe. And there's a lot of information in those slides as well. That we'll share the slides with everyone afterwards, so you can see that those comparison between qualitative and quantitative data in terms of objectives and methods and analysis. And I think in your example, we'll come to the questions in a moment, but well, I'll finish the presentation, but I just saw that there was a question that's very much related to what you were saying, Felicia. There's a question from Wade who says, can you give an example of how qualitative data is used to validate selected quantitative findings? And I think what you were describing about Zimbabwe was really that how the qualitative data indeed validated what you found through the quantitative data. I think that question has been answered, unless Felicia, you want to say anything else about that?
I think, as you said, as you rightfully said, Olivia, what findings from the household showed us what were the profiles of the most vulnerable households. So we took that list and we went to the community and sought from them, did they agree with these findings? And in their own opinion, what other characteristics of households that are vulnerable had been left from our data? Because as quantitative, you always have a margin of error when you do your analysis. So this was very helpful in giving us a complete picture of what it is they understand around vulnerable and what is the best characteristics of a household that is vulnerable within the TRS context. Thank you.
Thank you. Thank you. I've got a couple more slides and then I'll stop sharing and we can have more time for discussion. Very briefly, yes, this slide shows the JAF website, the toolkit. I shared already the link with you in the chat. Everything's available there. This gives an overview of the webinars that we've been holding. So this is the 4th webinar. The next webinar on the livelihoods add-on module is going to be next week. And then the last webinar on using the week after, using findings to inform joint programming. Yeah, and here are all our contacts. Please do get in touch for questions that you might have about the JAF. Please, yeah, don't hesitate to get in touch. And now we come on to questions. So I've stopped sharing my screen now, have I? Yeah? Great, okay, good. Thanks. So other presenters, apart from the example from Zimbabwe, does anyone else have examples of how qualitative data has been used to validate quantitative findings? Any other examples from your experience? Felicia's already answered it very well, but.
Yeah, I think so too. I think this is what we've done in different contexts, validating findings from the household surveys that we're not entirely sure about also? Are we maybe was a question misunderstood? So we want to make sure that we bring up certain issues in focus group discussions to clarify. If we already have results on who the most vulnerable types of households are, we can present like a list of these to community members and see what is their feedback. Are they really more vulnerable than others? Yes, I think also that Felicia has answered the question very well. Yeah.
Thanks, Michelle. Anyone else like to add anything? Felicia, go ahead.
Thanks a lot. Just to add another example, recently in the Zimbabwe example, we had the household data was showing us that school attendance was very high, which was, what the partner was not seeing when they looked at their attendance records. But when we went to the field, we actually realized that attendance was marked at a certain time and children were late to school because they were carrying household chores. So whilst it was done in the morning, children were indeed attending, but they were very late. So at least it helps us understand why from the household perspective, they are saying attendance is very high. But when we look at the partners' records, the attendance is very low. So it actually helped us understand, especially when the partners saw the figures, they were not too happy with the attendance because it was not, tallying with what they had in their books. So I think it helps us understand those discrepancies between what the partners or the implementing partners know about the community we're dealing with and what the community understands from the household survey. As Michelle said, sometimes there can be a misunderstanding of what we're measuring in the quantitative, but qualitative helps resolve those discourse in the data. Thank you.
Yeah, great example. Thanks, Felicia. There's another question from Mohammed about focus group discussions, asking can focus group discussions have more than 12 participants or respondents? Michelle, you were recommending 8 to 12 as being the ideal number, but what happens if there are more?
Yeah, so this is just, it's guidance, right? It should not be a strict cutoff. I think it's just from experience, it's good to have between 8 and 12 people, because if you have 16, 27, whatever, like those, it depends very much on the group, right? And how sort of also what the culture is, and if people are agitated for some reasons or not, if there have been assistance cuts just before or something like that. So it's good to have a smaller group. 8 to 12 is usually ideal, because the group will be easier to manage usually. But if you have, like, mobilization is not never turns out in a perfect way, right? You might have 14 people, or you might have 20, and then if you have enough staff members, you could even split the group of 20 into 10 and 10, if that's possible. So I think we have to be flexible, right? It's not a strict cutoff. I don't know if others want to add more to that.
Thank you, Michelle. Yeah. If no one wants to add anything, there's another question from Murad, which is about identifying. He asks, how can we identify or set up the thematic categories for the qualitative data? Is there an easy way to do so? Obviously, today we've been focusing on the tools that are developed within the JAF, which has a specific scope. But would anyone like to take this question about identifying or setting up the thematic categories for qualitative data collection?
Yeah, maybe I can try and answer. So in the JAF, the themes to cover during the primary data collection are already identified to be able to answer the indicators and the questions that are part of the framework. So when you download the focus group discussion tools, you will see that there are specific themes that have already been identified, and for each of the themes there are specific questions that will help you guide the focus group discussion. They can be adapted, and you can add more or delete some depending on the context and the information gaps that you're trying to fill with the primary data collection. So hopefully the tool will help you to structure the primary data collection and identify these categories.
Great, thank you, Federica. I'm conscious of time, but I see an interesting last question. Maybe we can try to answer this. Are there any AI tools to help in qualitative data analysis and extracting themes? Would anyone like to respond to this? Felicia?
Felicia, go.
Oh, thanks a lot. So the software we highlighted in Vivo, Atlas TI, and MaxQDA can actually extract themes from the qualitative data. It's very useful when you have large data sets because it does the extracting for you in terms of themes. But when you have small data, I would encourage you do the coding, you go through the steps. It helps you understand and appreciate the qualitative data analysis. And when you start using now tools, at least you do understand the steps that are being taken. Thank you.
Thank you very much, Felicia. Okay, I think we've come to time. So if people have other questions, please don't hesitate to email us. We'll try to respond. But thank you, everyone. Thank you, presenters. Thank you, everyone, for attending today, and have a good afternoon. All right. Bye-bye. Thank you.